I want to thank Councillor Jim Furfurl for coming. I appreciate that. I have talked to Karen Farbridge. We did meet. She's well aware of this project. We talked to her a few weeks ago, and she's very, very highly supportive. We've talked with the Sandals as well, and she also is extremely supportive of the project. In fact, all those that we've talked to have been extremely supportive and certainly very pleased with this. And I have to say that from our perspective, and from mine and our family and Paul, we couldn't be more excited. This is a project for us that is about vision, it's about passion, it's not about real estate. You know, you look at it and say it's a building, it's real estate. Well, it's not. This is not about real estate. This is about having a vision for healthcare in the city of Guelph, for the people of Guelph, by the people of Guelph, because we're all local people. And that's what this is about, is a passionate undertaking. And you may be able to tell by myself and Paul as we speak about it, this goes right to our heart. So I do want to thank you all for coming, and certainly appreciate you for that. I'm going to talk about the speakers this morning will be myself, Paul, the mayor, who hopefully will be here, but maybe Jim could say a few words if she isn't, if it doesn't arrive, and Lloyd with the Chamber of Commerce. I want to talk first, several parts of our discussion here. The first part is, some of you are old enough to remember me, and I know Jim is, because we went to school together, but he was 10 grades ahead of me, because he's much, much older as you know. But some of you are newer and don't. So I'm just going to give you a little bit of history about the Verdoni family, for those of you who are new to town. Our family has been building in Guelph since 1962. My dad came over in 1949, and you can guess from where. In 1962, he started building houses, and I can still remember the very first house he built. I know exactly where it is, and I know because I worked on it. And if there's anybody in this room, by the way, who's thinking of buying a new house in Speedville, let me know, because if you do choose that house, I'm going to tell you, please don't buy it. I was there. I helped build it. Don't buy it. I know that house. So I'm going to give you a warning if you're thinking of buying it there. So it's 51 years that our family has been building in Guelph. We've built many, many products. And what's nice about 51 years is a couple of things. My dad started. I spent quite a few years in it, and I don't want to say how many, unless it might age me. But the third generation, my son Michael, is third generation builder. That's how long we've been here. In all that time, the Verdoni name is associated with construction. We have built thousands of homes in Guelph. I really don't know how many, but I know it's in the thousands. We've built hundreds of thousands of square feet of commercial and office and industrial space. Not just Guelph. When I talk about all these numbers, although most of it was in Guelph, we did build in Kitchener, Waterloo, Cambridge, Oakville, Stratford, Southampton, and a few other places I've mentioned. So we've been around a long time, many locations, building many, many different types of products. And I think we have quite a few firsts to our name, and I'm not going to go into all of them because there's quite a few, but there is one which we're particularly proud of, and you all heard of Sobe Stores in here. They came to Ontario 25 years ago, and I can tell you where that very first store was built and where. It was built in Guelph on Silver Creek Parkway, because we built the shopping center where it was located, and our architect, Gary, right over there, he was the one who designed the building. He's the one that went out east. We've been talking to Sobeys. He's the one that went out east and finalized the agreement to bring them to Ontario. We had the very first store in Guelph. The second store they built was in Stratford, and I know that because, again, we designed the building and designed the shopping center they went into. Since then, they've grown quite a bit, and now they have Food Basics, which is their more discount stores. But that's only one of the first that we've accomplished through the years, and there's been many, many more. Currently, my son and I, we have 4 or 5 different projects underway in the planning stages or very close to construction. Condominiums, a lot of condominiums. We have roughly 400 plus condominiums in the planning stages, as well as commercial properties. So this being one of the offices and more offices, not commercial. So in total, we have roughly $200 million of real estate projects in the planning stages. We're not your small builder, you can tell from that, but certainly we know what we're doing. I think when we envisioned this project, and with the passion and vision that we have for it, we've put our name on it. Why? Because we're local. We've been here 51 years. The architects are local. They've been here Barry was designing buildings for us 35 years ago, so I should have said that. He wants to think he's not quite that old. But many builders, just local builders, local people who own this, local people who are behind it, local people behind the vision, and we stand behind it. We know it's going to work, and we're committed to it. Our name is on it. Dr. Paul Mendoza here is a local physician and a part of our team as well, and certainly our medical consultant, and we rely on them a great deal. I want to tell you, I'm going to talk about the building now from a perspective of building, not vision. In 1977, a very large office building was built in Guelph. Right over there, Cooperators building. This building, there's been no other office building built in Guelph or proposed anywhere close to that. This building is smaller than the Cooperators building, but it's the biggest building ever to be proposed or built in Guelph since 1977. This is it. And I think that's in itself a major achievement. But there's actually more to it, because you can build real estate, you can build buildings. They can take many different shapes, forms, and so on. But if you really want to build it, you want a Class A, what we call signature building. A building where you're willing to put your name on, a building that stands out as you drive down. I'll let Paul talk to that. But I need you, one thing we need to understand is the vision here. What is our vision? What drives us to do this? Because why don't we just put up an ordinary medical building? It'd be a lot less expensive, for certain, brick and some stone or something, and it'd be a lot less expensive than what we're doing here. And that's because this is not about real estate, it's about a vision. And the vision, what's our vision? Our vision is to provide a facility where we can expect to provide better health care. And through integration, we're going to do that. And we're going to flatten the health curve, the health care cost curve. And we're going to do that through the economies of scale. Those are from a building perspective, that's what our vision is, to do that. And by creating a community hub for health services, we're going to be able to achieve our goal of a more patient-friendly facility while offering the most up-to-date healthcare services through integration, state-of-the-art, and economies of scale. That's what we have in front of us today. I'm going to introduce Paul Mendoza, who's going to expand on the integrated part of the building and the wellness part, because they're two different things, and we think they're both important in healthcare today. Paul?
Hi guys, I'm Paul Mendoza. I'm a local physician in Guelph. I've been here 7 years. I'm involved with a little bit of everything actually. I currently take students from Kitchener campus of McMaster University, as well as I'm active mentor with physicians who are retraining in family practice with the College of Family Physicians. I serve on the board of St. Joe's, since I've got the locked unit at St. Joe's. I've done emergency medicine at Guelph General, and I'm currently there as a hospitalist, in addition to my family practice, which I boast as being quite large actually. People like to come. So this is a very exciting project for me because I'm involved in medicine, in the community at different levels, and I've always seen that we need an integrated center to service Guelph, an integrated approach where we can, and that means several things. Number one thing is to service the population, have a center where the population can come to, and hopefully, get everything from, get their surgical processes done, get seen in a walk-in clinic, go to the pharmacy, even stop at the cafe, they'll be totally served. Another way I see this integration being formed is because we're trying, as John mentioned, we're trying to integrate costs for different physicians and different groups and facilities within the building. For example, the medical school needs teaching rooms. They need sleep areas for the residents. They need video camera rooms where they can do their teaching, and then a conference room afterward where they can do teaching. In addition, the family health team, they often need teaching areas as well. They need the same rooms. A walk-in clinic needs as well. And if we can help these people to share all these rooms, this helps to keep their costs down while providing a fantastic facility for Guelph. And we also speak towards wellness. We see wellness from a World Health Organization point of view. We like to see them as And they define that as helping the person to reach their potential. And no matter what disability or ability they may have. And so the wellness aspect to it, we're trying to integrate many different fields, from osteopath, physiotherapy, occupational therapy, family physicians, nurse practitioners, nurse practitioner-run clinic, women's wellness, as well as surgical specialties. So this we're hoping will serve the complete wellness of the individual, both psychiatric, body-wise, and spirit-wise. So this covers the integration portion, covers the wellness portion, and I'm just very excited to be part of this opportunity to help serve Guelph.
Thank you. And we're expecting the mayor, but politicians they get so busy, so many calls on their command, they're trying to get off and home, and that's fine, we fully understand. But we do have Jim Furfro here, and we'll ask him to say a few words on behalf of the city. And Jim, please don't talk about you not going to school, please. That was like before the dinosaurs.
Good afternoon, everyone. I wasn't expecting this, John, but nevertheless, it's always a pleasure to be able to say something on behalf of the mayor of the city of Guelph. I want to congratulate you and Dr. Paul for this initiative, for this forward thinking. This whole concept of integrated services and wellness, health and wellness, is not totally new, and it's been around for a while. And about a year and a half ago, it was pitched, it was presented to the council as a potential area to explore and develop and possibly support this type of a concept. And it certainly has merit, it certainly had value. My only concern at the time with the project as it was presented, there was a price tag for that on the city's part. And I didn't feel comfortable saying that this is a great idea. I think it's something that is going to develop. It's something we're going to need because of our aging population. We have a health and wellness strategy. We have an aging strategy, an older strategy in the works. So it was going to happen. I just didn't feel, though, that the city should have to support something like that. When I read this email yesterday, John, and I got this invitation, I liked the concept, and I thought, I know you personally, I know Dr. Paul personally, I like the idea because of the potential in it, and I thought, I think I'll come and listen to this. And I need to say that you've done an excellent job in terms of keeping this project kind of under the radar. It hasn't been out in the public, no rumblings, no rumors, no nothing. But I think in addition to the physical features and the medical components of the project, what it has going is the integrity and the credibility of the individuals that are presenting this and are going to be behind it. You've been in town all your life, John. Your name's attached to this project as well as many others in the city. I like that because I know you're not going to leave. Dr. Paul is my personal physician, and I have a sense of his level of integrity and commitment. We couldn't have asked for two better principals to launch this particular project and bring it to the city of Guelph. So congratulations, wish you both the best of luck. And knowing you and the manner that I do, I know it's going to be a success and a real benefit and sense of pride to the city. Thank you, gentlemen.
You know, you could have taken half an hour and talk more about this if you wanted to. There's no time restraint, Jim, but perhaps later you can continue, just you and I. Lloyd Longfield is president of the Chamber of Commerce, of course. I think everybody in town knows Lloyd. If they don't, well, I'm not sure where they're behind you. Lloyd, come on up.
Thanks, John. Thanks, John. Just to continue with what Councillor Fafaro said, the name Verdoni is very well known and established in Guelph, and really in a lot of countries. The international work that John has done the schools and the orphanages and the health facilities that John has helped to create in the developing countries around the world, in Africa and South America, Central America, really speaks to his integrity and also that he knows how to get a job done. And for him to turn his attention back to Guelph is just a real blessing for Guelph to have a facility like this that's envisioned to help Guelph the way that you've helped so many people around the world in bringing healthcare and wellness and an integrated approach to both into communities. And also using local businesses and using BJC. We also have GJA communications, communications here with Francis and John, showing how to showcase a project like this and tell the story, and Aidan Ware is helping with the story. So looking at using our local community to put the word out on this and having local media here, of course, as well. The passion and vision that we see in front of us is something that I think the community can get behind, and we've seen that with Guelph over the years, that when we see a good idea, we get behind it. And already the center is filling up, and as Councillor Cafaro said, it hasn't even been public yet. But we have had meetings with the mayor. She cleared her calendar a few weeks ago in order to meet with John on a Friday afternoon, and got instantly behind the project because of the community well-being initiative that she is championing. The Chamber of Commerce got behind it because in order to fill up the Hanlon Creek Business Park, we need physicians, we need a center like this that will showcase Guelph as a place to bring families. And last week we had the announcements from Worth, and we were able to say to Worth, you've got to see what your neighbor's building just down the street. And he said, I like the neighbor on the other side of the street because that was Sleeman's. And he also, looking at Fusion Homes and Granite Works, that park is becoming a real showcase park for Guelph, and it will help us to bring more businesses to Guelph as well. So from that standpoint, it's a win. And then going forward with the University of Guelph, the Better Planet Project, we work with the university, the Chamber of Commerce, the city, and now with the Ascencia Center around community development and wellness as two of the pillars of the Better Planet